Now the conversion of the stimuli to electrical potential is called as transduction. After the process of transduction, the process of transmission starts where the converted stimuli passes through the neurons or the nerves, and finally when it reaches the sensory cortex of the brain, there is awareness or feeling of the pain that is called as perception. Now, in between the process of transmission and perception, there is another process that takes place called as the modulation, where adjustment of the impulse takes place by upregulation or downregulation. So, in summary, the events that are involved in the pain pathway are transduction, transmission, modulation, and finally perception. Now let me now tell you how the neural pain pathway from the effector organ to the brain is designed. Now as we had discussed, there are A delta and C fibers that arise from the effector organ. They form the first order neurons. They carry the pain and temperature impulses to the posterior horn of the spinal cord. Now at the level of substantia gelatinosa of the spinal cord, the first order neuron synapses with the second order neurons. Now these second order neurons actually arise and ascend towards the brain. Now the ascending pathway of the second order neurons of the nerves is called as lateral spinothalamic tract. And let me remind you that it carries the sensation of pain and temperature. Now, these second order neurons, they synapse with the third order neurons at the level of thalamus, from which the third order neurons arise and carry the impulse to the sensory cortex of the brain, and finally the pain or temperature is perceived. So, as we now know that NSAIDs can help in relieving pain by acting on the chemical process that leads to pain. Now, in the same way, pain can be treated via altering or blocking the pain pathway as well. Now, this is how is it done? Now, this is by sending a signal or stimulus that is greater and faster than that of pain. The pain pathway can be blocked. Now, how to do this? The best example of this is transcutaneous electrical nerve stimulation technique, where an electrical current is applied to the effector organ that flows through the pain pathway, and since the electrical stimulus will be greater than that of the pain impulse, it causes the release of endorphin and enkephalin, which are natural opioids, at the level of hypothalamus that descends down via the descending pathway to sit at the level of substantia gelatinosa, thereby blocking the synapse between the first and second order neurons. Now let me talk about the most common musculoskeletal pain producing structures, that are the joints, including the ligaments, the muscles including tendons and fascia, and the neural structures. Now the pain perceived by the patient may arise from one of the groups which I said, or it may arise from one or two groups. Now what do I mean by that? For example, when we consider a patient with low back pain, initially the pain might be due to mechanical effect or mechanical effect of tear on his annulus fibrosus. But in response to the localized pain, there will be associated muscle spasm and direct chemical stimulation of nociceptive nerve endings in the muscle. Therefore, the pain that started somewhere in the intervertebral disc has now moved to the paraspinal muscle. Furthermore, because of the close proximity of the primary site of injury, that is the annulus fibrosus of the IVD, to the spinal cord and nerve roots, it is likely that the neural structures such as the dura mater will also be stimulated either by chemical or mechanical means. Even after this, if the pain is not taken care of and if the inflammation still persists, then local fibrosis and scarring may develop, leading to further stimulation of nociceptive nerve endings.